Hello, I'm Dr. Jeff Cullers. Thank you for making this presentation a part of your educational future. I am excited and honored to share some very valuable information with you. I hope you enjoy this presentation and that it will improve your massage skills and assist you in helping people who suffer from acute or chronic musculoskeletal pain and dysfunction. In this presentation, you will be learning to assess and then treat various musculoskeletal conditions using simple yet precise massage techniques. Massage techniques that I use in my practice each and every day with incredible results. The various massage techniques presented include but are not limited to neuromuscular massage, deep tissue massage, trigger point massage, connective tissue massage, static compression, reciprocal inhibition, post-isometric muscle relaxation, active engagement techniques, cross-fiber friction, deep effleurage and or stripping, deep effleurage perpendicular to muscle fibers, skin rolling, and myofascial cupping. In order to maximize your learning experience with this presentation, you should have a thorough understanding of the anatomy related to the areas we will be addressing. The images shown are from the Trail Guide to the Body written by Andrew Beal. I suggest you use it or an anatomy reference as a guide when watching this presentation. I also strongly encourage you to visit the website www.scienceofmassage.com, developed by Dr. Rosh Cherchananov. This website is an invaluable resource for all healthcare providers. When registering for the website, you will need to use this access code, 2021. In addition, you should have a clear understanding of the contraindications for massage. If you do not understand contraindications, you must review them in a massage text or pathology reference. You will best learn the materials in this presentation by watching it in its entirety first. Then review it a second time and stop the presentation when you need to. If you've taken one of our CE classes, you may cross-reference the materials being presented with the manual provided in class. Next, watch the presentation a third time while practicing the massage techniques on someone. As part of your initial evaluation and periodic re-evaluations, I recommend you perform orthopedic testing, range of motion, and manual muscle testing. The objective data you find should be documented and used as part of your client's care plan. Although we will not be covering SOAP note documentation or keeping medical records, remember this word of advice. If it was not documented, then it was never done. Communicate with your client that the purpose of orthopedic testing is to reproduce the symptoms they are experiencing and to tell you if and when they feel any pain or discomfort. This objective data will provide you and your client evidence of progress and possibly regression of their care plan and their initial complaint. Remember, if you are not assessing, you're just guessing. In the various massage technique presentations, when performing the massage techniques presented, the pressure used should not cause your client pain or discomfort. If so, adjust your pressure accordingly. In the Orthopedic Massage Assessment and Evaluation series, you will learn to perform orthopedic assessment and evaluation skills, range of motion testing, and manual muscle testing for specific conditions. On behalf of the National Academy of Medical Massage, thank you. We hope you enjoyed this presentation. Let's begin with the treatment of the posterior neck. You're going to begin with your client supine. Next, apply a small amount of Cryoderm warming lotion and or Cryoderm myofascial treatment or whatever lotion you might have available to the entire posterior cervical spine. Next, place both hands on the occiput and gently traction the cervical spine superiorly and hold initially for 30 seconds. Instruct your client to take a very good deep breath, as if they're going to blow a balloon up for a child. After the first 30-second segment, you'll release, and then perform that same step again and have them breathe deeply, and you'll traction for 45 seconds. Again, sinking your fingers in underneath the base of the occiput, pulling that head into you. And after the second 45 seconds, you'll release. Continue to have your client breathe deeply. Again, sink your fingers in the base of the occiput. In this last step, you're going to pull and hold for up to 60 seconds. The caution is, if you've done your orthopedic testing and they do have a whiplash or a spasm in the neck, this might cause a little discomfort, so just modify your pressure accordingly. And then release. Next, using 2 or 3 fingers, we're going to perform a deep stripping stroke bilaterally along the cervical spine. You're going to perform this 5 times, moving superiorly from C7 to C1. Repeat this procedure 5 times, then moving inferiorly from C1 to C7. 2, 3, 4, and 5. 1. Here's thumbs, 2, 3, 4, and 5. Next, using 1 or 2 fingers, we're going to perform a deep cross fiber friction bilaterally, which means on both sides, moving from the spinous process to the transverse processes. We're going to perform this procedure 5 times at each vertebral segment, moving from C7 to C3. 1, 2, 3, 4, and 5. 1, 2, 3, 4, and 5. This is C5. 1, 2, 3, 4, and 5. C4. 1, 2, 3, 4, and 5. C3. 1, 2, 3, 4, and 5. C2, 2, 3, 4, and 5. And the base of the occiput. 1, 2, 3, 4, and 5.